I detected it in the shower in a hotel room in New Jersey on July 17th. So it's been over a year. My breast surgeon recommended a skin-sparing mastectomy with immediate reconstruction. And so then he recommended the Dr. Fine staff. I decided that Dr. Shirley was going to be my person because that's what he said he focused on. I'm not saying the other doctors didn't say that, but he said it like on the top of his list. My first consultation with him, they kind of had to jam me in as far as space-wise because he's so busy. And so I knew that I didn't realize how much time I was going to have with him because I was just a fit-in between appointments. But when he and I and my husband got into the room, it was totally focused on me. He spent whatever time I needed to have my questions answered, and it was well over an hour. And I thought that this is just great, you know, for somebody who's just kind of shooting in between appointments, that he would take this time to make sure that I understood where I was and what my process would be and what his part would be in that process.
I always say that we have this incredible privilege in breast reconstruction of meeting women on what is often the worst day of their lives, when they've just gotten the news of their cancer. And oftentimes it's at the end of a very long, tiring day that they get a chance to meet with their reconstructive surgeon for the first time and talk about their reconstructive options. This can be a bewildering and daunting array of surgical possibilities. And often what I just try to reassure them is that we're here for them and they don't have to understand everything all at once.
During one of my visits here, I had a discussion with Dr. Shirley, and we were talking about the next stages, because I would come in and just have conversations just to make sure that I'm on the same page as to what we're going to do next. And during one of those conversations, he talked about modesty and how sometimes you can lose your modesty because every time you're going to see your doctor, hey, look at this, you know, how's it going? So you just kind of lose that. And so as I sat there, he covered me up and he said that one of the things we're going to do is get your modesty back. He said sometimes you go through this process and you're thinking like, yeah, why do I need to do that? Why do I need to go any further with the reconstruction process? Because, well, it is what it is. And that was another one of those, I'm going to call it a watershed moment, where he was in my head thinking what I was thinking, but I had never shared with anyone. So because of that conversation, it still made me want to go steadfast to, I'm going to see this through the end.
I often will find myself reassuring patients that they are stronger than they think and they can get through this. One of the things that I find is that early on in the process, especially after the first surgery, especially if they've never had surgery before, it can be a fairly jarring experience to deal with what surgical scars look like and what the pain of a surgical recovery is like. Patients find themselves, I see patients thinking of themselves as their disease. They're thinking of themselves as a cancer survivor or as a breast reconstruction patient. As we move forward in the reconstruction and as they are able to start to see the fruits of the procedures that we perform and they begin to look and feel whole again, I'm very gratified by seeing two things return, both their modesty and their vanity. And nothing makes me more gratified than when a patient starts to ask me about maybe getting a little bit of Botox here and there, or they feel much less comfortable opening up their gown when I walk in to see them post-operatively. Initially, they often sit there with their gown open because they really feel like their breast reconstruction doesn't look like what breasts should look like. And helping them understand that this is a work in progress and that eventually towards the end of their reconstruction, once we've completed their nipple reconstruction and once our tattoo artist Jeff has completed their three-dimensional tattoos, you can just tell that there is a subconscious shift in how they feel about their bodies, because they'll often not want to open up their gown unless you ask them to, or they won't even change into their gown until you ask them to, because they feel like they have something to hide again. And that's very gratifying.
It means really kind of finalizing all that you've gone through. You know, that you were this type of person at the beginning physically, but at the end, you're still going to go back to being who you were, but only better, because you've learned so much. You've taken a journey that is different for everyone, but it just gets you back to the person you were, but a much better person.